Thank you for joining us today. We are thrilled to introduce the vision behind Centurion at Work, a better path to total wellness. Healthcare costs are too high. Insurance companies, government officials, and healthcare providers blame each other, and consumers pay the price. The healthcare system should supplement healthy living, not be expected to produce it. The focus should not be on increased legislation, public health care, or dependent on what is available through an employer-sponsored benefits program. The answer lies in empowering people to take control of their health and their individual needs. Analysis of CMS data from recent years reveals a consistent annual increase in U.S. health expenditure. Approximately 90% of healthcare spending in the United States is attributed to the management of chronic conditions. In 2024, the NCCIH stated that Americans spend approximately $30.2 billion annually out of pocket on complementary and alternative health methods, largely for chronic illness management. This is in addition to annual U.S. health expenditure. The NCCIH defines complementary approaches as non-mainstream practices or products used alongside conventional medicine, whereas alternative approaches are used instead of conventional medicine. Data from Novo One Advisor, a market research and consulting firm, projects substantial growth in the U.S. complementary and alternative medicine market. Using actual spend in 2023 as a baseline, they project growth from $35.27 billion in 2024 to $229 billion by 2033. This significant increase is attributed to factors such as rising costs for conventional medicine, a greater prevalence of chronic diseases, and increasing concerns about excessive medication use. Many other sources project similar increases, resulting in an estimated compound annual growth rate of above 23%. Alarmingly, about half of these treatments, practices, and products are ineffective, and many can be harmful, despite almost all claiming benefits or even miraculous outcomes. This indicates a significant financial investment by individuals seeking wellness who are often vulnerable to exploitation. Hi, my name is Carly Wainwright. I spent over 20 years building health and wellness programs for large companies. For well over a decade, my time was spent chasing how to better treat chronic illness as healthcare costs continued to soar while people just got sicker. I founded Centurion at Work in May of 2024 on a mission to create a better path to individualized wellness for everyone. We are building an app that uses an integrated approach targeting physical, mental, financial, emotional, and social health all in one place, available directly to the individual, no matter their employer. We use gamification to reward individuals for completing education modules, challenges, and activities, leveraging evidence-based programs built by subject matter experts. Centurion at Work also teaches goal setting in a manner that helps identify the root cause of the issue and assists to build a better plan to break down larger challenges into more manageable steps to build momentum. For example, someone who is seeking to lose weight doesn't only need to look at diet and exercise. In fact, that may not be their main issue. To maintain lasting change, they need to learn to identify what is driving their weight gain and consider the impact of other physical challenges, as well as their mental, financial, emotional, and social health. It's all intertwined and must be addressed as such, in a manner that is attainable and not overwhelming. Once progress is made to address the root cause, the individual begins to feel better, which has a snowball effect to encourage healthier living. I am excited to introduce the heart of Centurion at Work and what makes us different. I am analytical by nature, with a degree in finance and economics driven by facts to identify solutions. So let's start with some important facts we need to consider to create a better path to total wellness. As noted previously, the United States spent $4.9 trillion on personal health care in 2023, averaging $14,570 per person. According to Gallup's annual health and healthcare poll for 2024, only 44% of Americans are satisfied with the U.S. healthcare system, noting only 11% rating healthcare quality as excellent and 33% rating it as good. While it's natural to focus on the private healthcare system in the U.S. as the problem, public healthcare alone is not the answer. To offer a clearer view, we are comparing the U.S. to 4 other countries. This analysis uses the most recent finalized 2023 healthcare spending data publicly available from each country at the time of this presentation, with all figures converted to the US dollar for a direct comparison. The UK spent $369 billion in 2023, averaging $5,399 per person, while reporting lower healthcare costs. The UK has lower survival rates for critical illnesses and chronic diseases compared to the US. According to the 2024 British Social Attitude Survey, only 21% of the UK residents are satisfied with their national health system, citing access and service inadequacy. The Montreal Economic Institute reported that while 48% of Canadians are satisfied with the healthcare system, only 8% are very satisfied. 70% of Canadians worry about accessing quality care when needed. Canada's 2023 healthcare expenditure was $253.9 billion, averaging $6,179 per person. In contrast, Spain and Finland report the highest satisfaction with their healthcare systems at 71% and 70% respectively, as reported by the European Observatory on Health Systems and Policies for 2024. Spain spent $145 billion in 2023, averaging $2,985 per person, while Finland spent $17.1 billion, averaging $3,081 per person. While Spain and Finland have the highest satisfaction and lowest spending per capita among the countries we are reviewing today, the key to their success lies not solely in their healthcare systems, but in the overall well-being of their populations. The 2023 World Happiness Report published by the World Population Review shows that the US, UK, and Canada have similar happiness ratings with 6.89, 6.8, and 6.96 respectively out of a possible rating of 10. Spain has a lower rating of 6.44, while Finland consistently ranks highest. In 2023, they had a rating of 7.8. The 2024 World Happiness Report data reveals that most countries in the study have become less happy, thought to be attributed to economic, social, and political issues. The 2024 Bloomberg Global Health Index, which rates the health of 169 countries on a 100-point scale, gave Spain the highest rating of all countries at 92.75. Canada ranked 10th at 89.30, Finland 14th with a score of 85.89, the UK 18th with 84.28, and the US 34th at 73.02. The US's low score is attributed to obesity, poor diet, prevalence of chronic illness, and the lower life expectancy. The factor driving health and happiness in Spain and Finland may seem to be their socialized healthcare system, given their similar satisfaction and health outcomes. However, as we reviewed previously, their healthcare spending is among the lowest globally, indicating they are using services less. This suggests other factors are at play. Canada, with its socialized healthcare, also ranks among the healthiest countries despite dissatisfaction comparable to the US, which has a largely private healthcare system. Furthermore, Canada's happiness level aligns more with the US and the UK, while Finland's surpasses Spain's. This further emphasizes that health and happiness are not solely driven by the healthcare systems. So what drives health and happiness? Spain's cultural values promote health and well-being in many ways. The Spanish culture values spending time outdoors in the company of others, which encourages walking and an active lifestyle. Additionally, strong family bonds are prioritized, and rest and relaxation are considered an integral part of Spanish society. The Mediterranean diet, which is a staple in Spain, also contributes to a healthy lifestyle. Finally, individuality is encouraged, while comparison and competition are discouraged, which promotes finding joy in the simple things in life. Finland's cultural values and practices promote well-being through a strong sense of community and social connection. An active lifestyle is encouraged through walking, sports, and outdoor recreation. The country boasts the highest number of sports complexes per capita, with 90% of individuals playing sports at least 2 times a week. The Finnish diet emphasizes fresh, whole foods, and seasonal produce, mostly sourced locally. Finnish society prioritizes safety, well-being, and education, fostering a sense of security and trust. Wellness is a priority integrated into the school curriculum, starting for children at 9 months old with free public childcare. The Finnish concept of sisu embodies resilience and determination, while rest and sleep are recognized as important for health. Trust and transparency are core values in Finnish society, promoting strong relationship and collaboration. Spain and Finland are just 2 examples we see showing health and happiness are driven by a combination of factors, including rest, movement, mindful consumption, and a sense of community and belonging. The United States has the highest rate of chronic condition among adults, with 60% of the population suffering from at least one chronic condition and 40% having 2 or more. This high prevalence of chronic disease contributes significantly to healthcare costs. In comparison, the United Kingdom reports 50% of the adult population with at least one chronic illness. Canada reports 45%, Spain 34%, and Finland 49%. Although these percentages are substantial, the actual number of individuals affected is considerably lower than the US due to smaller population sizes. So does that mean Finland is actually not as healthy as they seem in studies? What the data tells us is there is always room to grow. For a greater understanding, let's look at the top 5 most prevalent chronic diseases for each of the countries in our study. Most of the leading chronic diseases in the US, the UK, and Canada are commonly attributed to poor diet and lack of exercise. In Spain, the prevalence of tobacco use has increased the risk of cardiovascular disease, cancer, COPD, Alzheimer's, and mental health disorders. Similarly, Finland continues to have a significant portion of the population that smokes, despite a recent decrease in smoking rates. Circulatory disease, cancer, mental health disorders, musculoskeletal disease, and Alzheimer's have all been linked to higher rates of smoking in Finland, as well as environmental factors like mold and neurotoxins. When we look closer at the smoking rates for each country, we see the United States has the highest rate of male smokers compared to all reviewed countries. The US also has a higher overall smoking rate and a higher rate among women than most reviewed countries, with the exception of Spain. Chronic diseases associated with poor diet and inactivity are more common in the US than those linked to smoking, despite the fact that smoking-related chronic diseases are apparent in US data. This is consistent with the finding noted previously that 60% of Americans have at least one chronic disease and 40% have multiple chronic diseases. Additionally, the median age in Spain and Finland is higher than in the US, which may contribute to the prevalence of conditions like Alzheimer's disease and musculoskeletal disorders among their top 5 chronic conditions. While the median age in the UK and Canada is only slightly older than the US, musculoskeletal disorders and osteoarthritis are still present among their top 5 chronic conditions, suggesting a potential correlation with age, but also indicative of a difference in key drivers causing chronic conditions in each country. The data review shows that modifiable risk factors are the main drivers of the most common chronic conditions. Although some factors are age-related, similar lifestyle changes can improve health at any age. Making these changes earlier in life may even prevent some conditions from developing as we get older. It's surprising to many that approximately 80% of chronic conditions can be avoided completely. The following represents just some examples of chronic conditions where prevention plays a significant role. Though not listed separately here, many reproductive health issues in both men and women are preventable, often attributed to symptoms of these conditions or treatment side effects. In the US alone, approximately $8.9 billion was spent at fertility clinics in 2024, and this figure is expected to rise to $16.8 billion by 2028. Currently, IVF has a 55% success rate for women under 35, decreasing greatly with age to as low as 20% for women between the ages of 38 and 40. Taking preventive measures against chronic illnesses can positively impact fertility and boost the success of IVF treatments, even though not all fertility challenges can be avoided. It's also worth noting that some disorders such as celiac disease, ulcerative colitis, irritable bowel syndrome, and irritable bowel disorder cannot be prevented but may be managed effectively without medication. The techniques effective in preventing chronic conditions can also significantly benefit individuals who develop conditions due to genetic predisposition or those living with non-preventable chronic illnesses. Similarly, up to 80% of chronic diseases can be partially or fully reversed, primarily through lifestyle changes. The conditions listed below represent a sample of the reversible chronic conditions that are frequently observed as prevalent in numerous countries. Respiratory diseases such as COPD and environmental asthma and musculoskeletal disorders like arthritis are typically not reversible, although they can be better managed through lifestyle changes. Additionally, reversing a chronic condition can improve related complications such as reproductive issues and chronic fatigue. So how does Centurion at Work propose we better prevent, treat, and even reverse chronic illness? The concept of holistic well-being is not new, but it has evolved considerably. While some frameworks identify up to 8 pillars, the core elements can be effectively categorized into 5 key areas: physical, mental, financial, emotional, and social health. Historically, well-being has been viewed in a segmented or siloed manner. However, a more accurate understanding recognizes the interconnectedness of these aspects. Each facet of holistic well-being influences the others, and the relative importance of each may fluctuate depending on individual circumstances and even by day. For instance, financial difficulties can manifest as mental or physical health issues. These struggles can also negatively impact social and emotional well-being through isolation or an inability to engage in enjoyable community activities. Similarly, a physical health problem can affect mental health, hinder social and emotional connections, and create financial burdens due to the cost of care or limitations on their ability to earn income. Conversely, mental health challenges can often lead to physical health issues. Recognizing these interdependencies is crucial. Addressing any one of these areas positively creates a ripple effect across the others. For example, an individual experiencing improved physical health is likely to see positive changes in their mental, financial, emotional, and social well-being, leading to a more comprehensive sense of wellness. This concept forms the core of Centurion at Work and is central to our education modules. These modules utilize evidence-based programs developed by subject matter experts and are individualized. This personalization ensures relevant learning experiences based on key user characteristics. There are 4 key factors to consider in preventing or even reversing chronic health conditions. They are rest, consumption, movement, and community. Furthermore, these same 4 factors can help improve treatment and greatly increase outcomes for conditions that are not reversible and really lead to a healthier and happier life for everyone, whether they are struggling with health issues or not. Our mistake in the past has been considering these as separate factors. We've also restricted the impact by limiting the reference to sleep, nutrition, and exercise. You see, like the concept of holistic well-being, these factors are not mutually exclusive. Rest, consumption, and movement can overlap, and the results of focusing on each are amplified when we allow community to encompass it all. To live healthily, it's clear that rest, movement, consumption, and community are all essential. However, too much of anything can be harmful, from negative influences from excessive social media or stressful environments to seemingly positive activities like rest or exercise. This is particularly important to those prone to addiction, as a moderation in any area can be damaging. A healthy lifestyle involves everyone finding their own equilibrium in all life aspects, regardless of the perceived positive or negative nature. It's crucial to examine what drives excessive behavior, consciously or unconsciously, and to understand the root causes. The challenges and activities in our app are designed to help individuals apply what is learned in the education modules, focusing on the 4 key factors for healthy living: rest, movement, consumption, and community. These elements are incorporated into everything we do. So what's next? Currently, Centurion at Work is in development. However, you can stay informed by visiting centurionatwork.com to subscribe for updates on our progress and to receive launch notifications. If your organization provides physical, mental, financial, emotional, or social well-being services or education, and you're interested in learning more about joining our expert network, please reach out by clicking the LinkedIn or email links on our website. Thanks so much for your interest in Centurion at Work. I look forward to connecting again soon. Until then, be well.